Okay, so it's 6:30.
Yeah.
Should we start? I'll start off.
We can start,
Hello,
yeah.
hello and welcome to our Laser Vision Eye Centre webinar. I'm David Anderson. You'll meet Aris Konstantopoulos, and together we'll introduce ourselves, tell you a little bit more about who we are and what we do. We'll also introduce you to the clinic. I'm sitting in the laser suite at the moment, and we'll talk you through some of the procedures that we offer and how they can help you achieve the goals that you want to achieve. A big part of the webinars and our live presentations is asking and receiving questions. So hopefully we aim to demystify a lot of the terms that surround ophthalmology and particularly laser vision, because it tends to be quite complex and optical. So we hope to demystify some of those terms and explain them to you. But please do ask us questions. So to keep the webinar moving along efficiently, we'll take the questions and answer them all at the end of the webinar, but please do post them as we go along, and then we have them ready to answer at the end. So I'll hand you over to Aris.
So thank you, everybody. Thank you for joining us this evening to find out a bit about laser eye surgery and how we can improve your eyesight or get you out of contact lenses or glasses. As David mentioned earlier, I'm Aris. I'm a consultant ophthalmologist, eye surgeon. I'm predominantly based at the University Hospital Southampton, in Southampton, obviously, but we have our Laser Vision Eye Centre at the Nuffield Wessex Hospital, which is on the outskirts of Southampton in Eastleigh. And as David alluded to, we specialise in the front part of the eye. So we're cataract, corneal and refractive surgeons. So that gives us the wider spectrum of knowledge and skills in treating a variety of conditions and finding what is best for your needs and what is best for your eyes. And David, you can
Thank you, Aris.
Introduce yourself.
Yeah. Yeah, well, I think Aris has summarised that very nicely. I've been a consultant surgeon here since 2003. Both of us have a very wide experience in refractive surgery. I began LASIK back in 2000, 2001, and I think one of our missions really is to help you improve your vision. So although today we're going to be concentrating on laser vision correction, but also touch on other treatments that you may find helpful, and we will always look to give you the best treatment, whatever that is, to help you achieve some of your goals.
So as we've just been alluding to, we've been doing refractive surgery and eye surgery for many, many years, for more than 20 years individually and more than 40 years collectively. So we've got quite a broad spectrum of experience, and hopefully we can improve your eyesight. And as we said earlier, we're just going to cover what laser treatment options there are available, what we provide. Some are exclusively provided by our laser platform and us, and also what other treatments potentially we can provide for you if by remote chance you're not suitable for laser treatment. There's a variety of other options that we can explore in order to improve your vision. And at the end, obviously, there's plenty of time to ask questions. You can send your questions in as we go along if you think of questions, and then we can just answer them at the end just to help with the flow of the presentation. So when we found
questions, sorry, yeah. Aris, I was going to say all questions are welcome. So there'll be some very, very specific questions that you may have about your eyes. They may be better handled at a screening or a consultation, but please ask anything you want to.
Yeah, we founded Laser Vision Eye Centre 2 years ago, and although David predominantly has been practicing since 2003, David, doing LASIK.
Yeah, we first started laser vision correction here back in 2003, and yeah. I think we just had this tremendous opportunity really in 2018 to relaunch Laser Vision Eye Centre here and to bring really state-of-the-art treatment. We say state-of-the-art in medicine. We're very conservative. We like to wait a long time. I think, Aris, when did you start performing Smile?
I first did Smile in 2014 or 15 during my fellowship in Singapore. So it's been a good 6 years now, and that was my first experience of this laser platform. So when we talk about laser platform, we just talk about the laser equipment and the software. And you can see in the background, just behind David, you can see the laser, the VisuMax laser that performs the Smile laser eye procedure. Yeah. So we'll show you.
You talk about a Smile as being that I think it's the fastest growing laser refractive procedure, but it's been around for a long time.
Yeah, it's been around for more than 10 years or 11 years now. So we founded Laser Vision Eye Centre in order to bring that excellence in eye care to the south coast and to the south central of England, and bring the best technology will allow us to provide the most advanced and safest range of procedures. And a couple of procedures are available exclusively to this laser platform. You heard us talking about Smile briefly. There's also another procedure called Press Beyond if you're needing reading glasses. And we'll go into detail to explain the advantages of each of these procedures. And by talking about the best and the most modern technology, what this means is safety. So our paramount aim is not just to have the best technology of the fastest car or something like that. It's just have the safest procedure for you and the best outcome for you. Where can you find us? Well, as you heard me say earlier, we're predominantly based in Southampton or the outskirts of Southampton, which is Eastleigh or Chandler's Ford, but we run clinics in a variety of locations, predominantly at the Guildford Nuffield Hospital and at the Lido Medical Centre in Jersey. And you'll hear us talking about the Nuffield on a couple of occasions. Our laser centre is based at the Nuffield Hospital in Southampton. It's a partnership with the Nuffield Health Group. We also have other clinics at the Spire Southampton Hospital and also at Lymington. So you can see us in a variety of locations to suit you, where we can discuss what options there are for you. We can do a basic screening and to see whether you are suitable for your laser procedure or any other procedure that might be the best option for you.
I think one of the big benefits we've found practicing at the Nuffield, which we've done for many years, is that we really have an eye hospital within a private hospital. So we have all of the facilities available of a big hospital group. We have single occupancy private rooms. So we have a really nice environment for you to come into, social distancing in place. Everything is completely private. You come into a private room with its own ensuite and you'll go through the hospital in that way. So we don't have large shared areas.
And also within the Nuffield Health, you've got the reassurance that all the safety parameters have been taken into account. It's a big hospital, so all the safety parameters, particularly in relation to COVID and adhering to social distances, and all the investigations beforehand have been carried out. So next we're going to talk about how the eye actually works. And it's quite a complex structure, but David, you can talk us through this. This is an archive slide.
It is an archive slide, but it's a great explanatory slide because it really looks at the two major components that we're interested in. For me, that animation's not moving, Aris.
Yep.
Here we are, brilliant. Essentially, we're looking at two major components in the eye. We're looking at the front part of the eye, which does the focusing light, and then the back part of the eye, the retina, which is a membrane that lines the inside of the eyeball that receives the focus light, and that focus light is then converted into an image and the brain decodes that image. And in the front part of the eye, we can see two really important structures. One is the fixed focus, that's the transparent dome right at the front of the eye, that's called the cornea. And then within the eyeball itself, we have the lens, that's shown in yellow. And the lens is the structure that is able to change focus. So that's the part of the eye that allows us to see from up close to the horizon if we've got good vision when we're younger, and that gives us variable focus. Laser vision correction is performed on the outside of the eye. That's one of the reasons why it's very safe. We're really an external eye procedure, and very, very, very small changes in the shape of the cornea allow very big changes in vision. So when we measure a cornea is only about half a millimeter thick, but thousandth of a millimeter change with precise instruments have a profound effect in sharpening and improving vision.
So we're going to talk about the most common refractive errors, and the most common refractive error, and by refractive error we mean basically the prescription that you need either in terms of glasses or contact lenses in order to focus your vision. So basically, in order, you saw the slide that David presented, the animation, the light rays normally focus on the retina. So in order for us to see clearly, the light rays need to focus sharply on the retina. When we're short-sighted or myopic, the eyeball is slightly longer than required for the refractive power of the eye, so the light rays focus just in front of your retina, as you can see on the image here. And what that means is that your distance vision is blurred, but for close-up, depending on the amount of short-sightedness that you have, you should be in focus. And that is what short-sightedness is, and the glasses or contact lenses just alter the light rays so that they come sharply into focus on the retina. Another common refractive error or prescription is long-sightedness or hyperopia. And this is the opposite of short-sightedness. It's when the eyeball is slightly smaller than the requirements of the refractive power of the eye. And what that means is that the light rays focus, again, not in front or on the retina, but behind the retina. And by your glasses or contact lenses or refractive surgery, what we do is focus those light rays sharply onto the retina so that your vision becomes sharp and clear. Astigmatism. Again, David likes explaining astigmatism, so I'll leave it to David to explain astigmatism.
So I think, thanks, Aris. So I think if you see a plus sign at the beginning of your spectacle correction, broadly speaking, you're likely to be long-sighted or far-sighted, and people tend to become a little bit more long-sighted with time. If you see a minus number in front of your spectacle prescription, then you're likely to be short-sighted. Most short-sighted people develop myopia in their early teens, and I think it's about a quarter of the UK population now, Aris, that are myopic.
Yeah.
Okay, so with astigmatism, the cornea in particular is focusing at different powers in different directions. So typically that means that the focal power is different vertically from horizontally, and the effect astigmatism has is to make everything slightly blurred, and you can see in that image that sort of edge effect that's apparent throughout the whole picture. Now, most normal human corneas are astigmatic, but once astigmatism reaches more than about 3/4 of a diopter, 0.75, then that starts to have a negative impact on seeing clearly and sharply.
And to mention about astigmatism is that it doesn't predominantly affect distance or near vision. It tends to blur your vision overall, unless you have a very small amount of astigmatism. But once you have significant astigmatism, you'll blur both distance and near vision.
And typically it goes up with the correction. So if you become more highly myopic or more highly hyperopic, often your astigmatism will also increase. Not always, but sometimes. Yeah. Okay, Alice.
So we sort of alluded to, David mentioned that quarter of the population in the UK are short-sighted, and overall a much larger percentage of the population use glasses or contact lenses. Everyone above the age of 50, 55 will be needing some correction for reading. It's inevitable, it will happen to all of us. as we get older, the lens inside the eye, the normal lens, just loses its elasticity. We'll talk about it a little bit later in more detail. So all of us above the age of 55 will need some visual correction in order to see close up. Even if we've had no problems, if we've never had reading glasses or contact lenses before, after a certain age, we will need some visual correction for reading and close-up vision. And laser vision correction is a great procedure. It's a great opportunity to address any refractive errors and see basically better. You can improve the quality of your vision. You don't need thick glasses, whether you're short-sighted or long-sighted, or take any risks that contact lenses may have. Because David and I, for our NHS work, we see quite a lot of patients that have contact lens related problems. There's millions of contact lens wearers out there, but it's not uncommon. We probably see a contact lens wear related problem on a daily basis. On a weekly basis, we probably admit someone with an eye infection in relation to contact lenses, so they're not without their risk contact lenses.
And I think as well, we have a lot of inquiries coming in now because we're all using screens more. People are at home, they're Zooming, and I think the number of contact lens issues, just wearability, have been an issue. I had laser vision correction myself many years ago because we often, again, as Aris has said, we often get asked about, well, what's the safety of LASIK? But typically, actually, it's the other way around. I had laser vision correction to get out of wearing contact lenses because it is a safer alternative. And then really the benefits of having laser vision correction for all of the other reasons became apparent to me. So all of a sudden I didn't have to have, spare glasses to play sports or to do activities, or if we went on holiday, you have young kids and you go to the beach, you're not worried about taking, prescription glasses and prescription sunglasses and spare pairs of glasses and spare pairs of contact lenses. So I think the convenience factor and almost the liberating factor of not having to wear spectacles and contact lenses for me was really a secondary gain, but primarily I did it because of the safety of laser vision correction.
And it's definitive and permanent. You haven't had to wear glasses or contact lenses since you had the treatment. So it's probably a distant memory now when you used to wear contact lenses.
It really is, absolutely, yeah.
So now we're going to go on to explain a little bit more in detail what laser vision correction is and why it's such a great procedure compared to other options like contact lenses that we mentioned. Again, lasers are very, very precise instruments. They can remove a tiny, tiny amount of tissue in order to correct your refractive error. And with that ability to remove minute amounts of tissue, we're talking about microns of tissue, which is smaller than the thickness of our hair, we can achieve great precision in correcting your refractive error. So with lasers, we get precision, we get speed of procedure, so you're not lying there for a long period of time, you're literally lying there for treatment. Treatment only takes seconds. There's no pain involved with the procedure, just because laser does not induce any pain at all to your eyes.
So I think that's really important because often people think that you can feel laser in some way, shape or form. But again, I can tell you myself from my own experience, you can't feel laser. I think the other aspect often is when people see, we look at the shot of this equipment, and to us it looks fantastic, but sometimes people come in and they look at this and they think, wow, what am I kind of letting myself in for? I think when you look at all of this, the only part in LASIK, I've got one of these little cones to show you. The only part of this that's going to touch you is this tiny little plastic disc with a central glass curved surface. So when you lie down on the couch for LASIK or SMILE, then this little cone is going to sit just on the inside there. And then Aris or I will drive that around to you. You'll be looking straight ahead, and then that will sit very gently on your cornea. So gently, in fact, that you won't feel it. What will happen is that your vision changes subtly. And all the while, because your eye is numb, with drops, it feels as if you're blinking normally. So I think another misconception is somehow you feel as if your eye's going to be kind of held open and you'll want to blink, but you'll be lying there looking straight ahead, and it really will feel as if you're blinking normally, although of course you won't be.
Yeah. And as you can see from David's background there, this is exactly the laser platform that we have. We've got two lasers, one on the left-hand side here, which you see that's called the VisuMax laser, which is exactly behind David there. And that is the one that helps us create the flap, and I'll show an animation of that. And to the right, you can just about see it. We've got the other laser, the eczema laser here, which is called the MEL 90. And in between the two lasers, we have the bed that you lie onto when you come into the laser suite. And depending on what part of the procedure, what procedure you're having done, we either move the bed to the left or to the right, depending on what laser we're using at the time. And sometimes for some procedures we use both, for some we only use the VisuMax laser. For example, for SMILE, we'll only use the VisuMax laser, whereas for LASIK, we'll need to use both lasers. And again, we'll go over that in more detail because we've got some animations for you. So what treatment is best for you? It really depends on what you want to improve. For example, if it's predominant distance vision, near vision, a combination of both, one treatment might be better for you, and it also depends on your eye. And that's why it's important that you spend some time with us in the clinic and we ascertain your needs, we examine your eye, see which procedure is best for you and what you want to achieve. But broadly speaking, yeah.
Sorry, I was going to say, a lot of people say, well, why does it take so long? We will come back to our complementary screenings, which are very convenient and quick, and that will give you a technical answer as to whether laser vision correction is possible. But the medical consultation really is a kind of deep delve. We want to find out about what you like doing, what are your activities, what do you want to get out of treatment, and of course you need a thorough medical examination. So we spend quite a bit of time re-examining your optical correction, dilating your pupils, and making sure that you have a thorough medical examination to make sure all is well with your eye. And then based on all of that information, we can then start recommending which treatments which we think are going to work best for you.
Yeah. So broadly speaking, there are three types of procedures, and I'll just name them initially, and then we'll go into more detail. So nearly everyone that comes and sees us has heard of LASIK. That's by far the most common laser vision correction procedure. Then we have SMILE, which isn't a dental procedure. It is an eye procedure, and I'll go on to explain that in more detail. And we also have LASIK, or advanced surface ablation. And I'm going to focus predominantly on LASIK and SMILE because they are by far the most common procedures that we perform, but in general, they are performed worldwide.
Yeah. How many lasers now are we up to globally, Aris, for LASIK and SMILE, do you think?
I think we're about 30 million or 40 million for LASIK, and several million for SMILE. So,
and I think with nearly 30 years down the track for LASIK. So these are really well characterized, probably the most heavily investigated medical procedures, and arguably the safest medical procedures there are.
Yeah, it's the most common elective procedure, LASIK. So it's very, very common. And by all these millions of procedures that have been performed, it has become very, very, very safe. Very, very safe procedure.
Okay, LASIK. Aris, talk us through LASIK.
I'll talk you through LASIK now, and I'll press the play button. And on the left-hand side, initially, you will see how LASIK was done many, many years ago, which involved the creation of a flap with a blade. Nowadays, we don't do that, and we only do the procedure on the right-hand side that you can see. And you can see little bubbles created by the laser within the cornea. And what that does, it helps us create a flap that we lift off. And what that does, it allows the second laser, the eczema laser, to reshape your cornea just by minute amounts in order to match the refractive correction that your eye needs. And then we reposition the flap, and that becomes part of your eye and firmly attaches within a day or two. And the whole procedure literally takes seconds. So the laser is actually working for seconds on your eye, but the whole procedure will take much longer because you come into the eye room, we get you comfortable on the bed, we use a nice pillow so that your knees are comfortable, we use some numbing drops. So the whole procedure will take probably about 10 to 15 minutes each eye, although the time we're actually doing something on your eye or each eye is probably a minute, would you say, in total, David? So
yeah, I think so. I mean, I think we people like to talk about generations of treatment, but I think Aris showed you the microkeratome. That when I started LASIK, we used microkeratome. So it was a great procedure. In 2007, we moved to femtosecond lasers, which really changed LASIK in a huge way. I think you probably call that second generation LASIK. I think now we're on third generation LASIK with the VisiMax because of the comfort level. It sounds like such a small change, but the way the VisiMax creates that plane, it does it with a curved surface that is really comfortable. So I think the difference now is that it's just a different experience, and that flap creation takes, as Aris said, about 7 seconds, with the shape change taking typically typically under 20 seconds, and almost always under 40 seconds.
Yeah. So we'll go on to another procedure which has a track record of more than 10 years now, and it's called SMILE. And what it stands for is small incision lenticule extraction. And I'll go on to explain what I mean by a lenticule, but it's a little disc of tissue within the cornea that the laser creates, and that's why it's called a lenticule. And that is the tissue that we remove from your eye in order to alter its shape. And that is done just with one laser, the laser that you see behind David, and that's the VisuMax laser. And basically doesn't create a flap at all. So we didn't play that, I'll go back. So I press play, here we go. So you'll see again the little bubbles created within the cornea by the laser, but you get two different planes. The bubbles are created in two different planes, and they create a little lenticule or a disc within the cornea. And then we only make a small opening in the order of 2 to 3 millimeters. And through that, we just peel out that little disc of tissue that the laser has created for us. And then the cornea just sits back, and that little incision closes itself within a day or two. So the incision is much smaller in SMILE compared to LASIK. And there are certain advantages potentially to SMILE compared to LASIK. Potentially you can return to work a bit sooner than LASIK, but all these gains are very minimal. LASIK has evolved, as David said, has evolved over the years to such a great level that all the benefits of SMILE that have been shown are very small. So yes, potentially you can return to work a little bit quicker by a day. If you're into contact sports or exercising, you can probably gain a couple of days compared to LASIK. But those are the advantages that we're talking about. So the advantages are not massive, but potentially a little bit quicker recovery for SMILE compared to LASIK, particularly if you're into sports. If you want to go swimming, for example, then I would say definitely you're better off with SMILE. But for other things, the gains are quite small.
Yeah, I think, and the other thing to say is that the final outcome, so how well you see afterwards, is identical really between these treatments. So SMILE and LASIK both have excellent and near identical outcomes. SMILE has been very much something that has been on the top of the wish list of refractive surgeons and ophthalmologists for many years. So we were really delighted that we were able to offer that for myopia here in Southampton.
Absolutely. So, okay. You want to take this slide, David?
Here's something that either will make complete sense to you if you suffer from it, or no sense at all if you don't suffer from it, but it's the inevitable requirement for reading spectacles. And I think now the frustration that people really have is not so much that you're sitting down reading a book, because lots of people read devices and Kindles, but where they can make the font bigger and so on. But I think the frustration now is that if you're using a smartphone or a smartwatch, there are lots and lots of devices that we use at proximity. And typically from our mid to late 40s into our 50s, that's when this age-related loss of focusing ability, or presbyopia, starts to affect us. And really until more recently, we've approached this by people have often used contact lenses, one powered for distance or one powered for near, or laser vision correction with one eye clear at distance and one eye for near, or even multifocal lens implants. But I think now we have, with Presbeyond, which Aris is going to talk about in a minute, a really fantastic treatment that can maintain the visual quality that we get with LASIK, because LASIK offers excellent visual quality, but also can restore some of that depth perception with a blend between those two focal powers. So Aris, talk us through how that's done.
So yeah, so as David said, Presbeyond is sort of based on the concept of monovision, but at a much more advanced level. And what Presbeyond basically is a variant of LASIK. So you saw LASIK being animated earlier. So it's very similar to LASIK, but the software and the profile that the laser uses is much more advanced, taking into account different measurements from your eye. And basically what we do with Presbeyond is focus your dominant eye. We all have a dominant eye, i.e. an eye that we prefer to use for distance, and a less dominant eye. So we tend to focus your dominant eye, which is the eye that you use for a camera, or you like to prefer to look at objects when you close one eye. Most of us will look at the distance with our dominant eye. So we tend to focus that eye for distance, and your less dominant eye, we tend to focus for near, based on the measurements from various scanners and also the prescription that you're wearing. So one eye is focused for distance, one is focused for near. But what this software does, it sort of creates a great blend zone that you heard David mention earlier. And what we mean by blend zone is that there's an overlap in distance and near vision between the two eyes, so that you don't notice the disparity between the two eyes. So when you're out and about, having had Presbeyond, you do not notice that one eye is focused for distance and the other eye is for near, and that is because of that blend zone predominantly. And that's the advantage of this Presbeyond procedure. Of course, if you cover one eye, you will notice that your dominant eye has been focused for distance and the other eye is for near, but with both eyes open, you won't notice any disparity, and your intermediate vision will be in focus as well. So you got that great and broad blend zone there. And that's the advantage over monovision, for example.
And it also corrects any underlying refractive error. So you can have Presbeyond if you are short-sighted, you can have Presbeyond if you are long-sighted. Most people have it because they're long-sighted, but it can be a combination of the two. And of course, you can have Presbeyond if you're astigmatic. So all of those refractive conditions can be treated so that the vision is corrected to where it should be. And then when the vision is corrected to where it should be, we create this blend zone between the two eyes.
Yeah, absolutely. So what should you do next? Well, what we need to do is find out if you're suitable for laser vision correction. And by far, probably in the order of 95, 98% of the patients we see are suitable for laser vision correction. And as we mentioned, if you're not suitable for laser vision correction, there's a variety of other options to consider. And what we can do initially is provide you with a screening consultation. So if you phone up or send us a message through the website, we can book you in for a screening where we look at your prescription, and we take scans of your cornea to see if laser vision correction would be suitable for your eyes. And that would be the initial thing to do. And following that, we can book a further appointment where we can go into the detail that we mentioned, where we discuss what you want to achieve, what you do for a living. Do you need really good close-up vision? Do you want to improve your reading vision? What aspect? Do you play golf? Do you want to be, sharply in focus just for distance and not for near? So we take all these parameters into account, and also quite detailed examination. For presbyon, we simulate your distance and your near vision to see whether you're comfortable with that treatment. So again, we spend lots of time in clinic simulating a couple of options for you. And that's why it takes a long time. You'll probably spend a good hour with us in clinic going through measurements and simulations.
And I think that's really important, because we all want to achieve the best vision that we can possibly achieve, but we all have such a wide variety of visual goals. So, I have patients who are solicitors, and when I speak to them, they say, well, I might spend 8 or 9 hours or 10 hours a day reading from a screen at work. And if I say, well, what do you do to relax? And they may say, well, actually, a lot of the time I actually go home and I read. So that near vision, particularly if you're presbyopic, is really important to them. We have people who enjoy being outdoors, particularly where we live in Hampshire. There's lots of things to do outside. And again, there you may want to have that kind of pin-sharp distance vision. So all of those things we take into consideration. And our role, really, apart from performing the surgery, which we will do for you ourselves, is really to try and guide you to the best treatment that's right for you. And Aris says, if that's not laser vision correction, we are surgeons that specialise in treating the front of the eye, and in particular the focusing mechanisms of the eye. But very rarely, but it happen sometimes, we may say, look, for whatever reason, this isn't for you. We both are actively engaged in research, and we go to a lot of medical conferences. We have a good idea of kind of what's coming through the pipeline in refractive surgery and what's happening next. And sometimes we'll say to you, look, if we don't think you're going to get an excellent result for treatment, don't have it, wait. And we know that something better may come along for your particular circumstances. But most of the time, we're pleased to be able to offer treatment that's going to work. I think the current precautions that we're taking in hospitals do mean that everything is taking a little bit longer. So we do have really high demand at the moment. We have all of the social distancing measures in place, and the clinics are run in accordance with that, but there is high demand. So if you are thinking about coming in, or if you just want to find out, for example, for a complimentary screening, am I suitable, would advise you to get in contact, at least book that in so that you find out for yourself, and then hopefully we can get you in for a medical consultation.
Yeah, and as David said, I mean, the main limitation now is social distancing. We cannot see as many patients as we were seeing beforehand, and that's what is resulting in longer waiting times than what we had before. So it's a consideration that things just take a little bit longer now. And this slide here just shows you our contact information, our email, and our phone number. It's available on the website and on the registration email that you've had. So please get in touch, at least to book up. It's you can get a free screening anyway, so you can always book that. And this is our website. Top right-hand side, you can see where you can book your free screening visit. And we can take it from there and advise you if you're suitable or not, and then recommend an appointment to follow that up with. And as we've said earlier, what happens if you're not suitable? What other options are there? Well, there's lots of options available, but these are, again, two sort of most common alternatives. One is called an ICL, which is a little lens that you see on the left-hand side here. And I call it very similar to a contact lens. it's probably similar dimensions and similar thickness. And where that lens goes is inside your eye. So if you think of a contact lens, rather than sitting on the eye, whoever wears contact lenses will know, it actually goes inside your eye, and it's a permanent lens made of a plastic-like material. And it stays there for life. It doesn't cause any problems. It's not something you can see there. Your friends cannot see it there. So it sits right in front of your own natural lens. And that provides the same power that your glasses or contact lenses prescribe, so that your distance is focused mainly your vision is focused mostly for distance. Okay. Of course, we can always alter things and focus you for near, but the majority of patients that have this procedure tend to have their eyesight focused for distance. And on the other hand, here on the right-hand side, you see an intraocular lens, and there's a procedure called refractive lens exchange or lens replacement surgery. It goes by a variety of different terms. And what we do in this procedure is remove your own lens, your own crystalline lens, and replace it with this lens that you see on the right-hand side. So exactly in the same position as your own crystalline lens, we place this new artificial lens. Again, it's made of a synthetic material, similar to the ICL. Dimensions and everything are slightly different. But again, it provides the refractive power that your eye needs, so that you're focused predominantly for distance, although we have the option, again, the majority of patients prefer to have both distance and near vision once they have this procedure. And you can see the little rings on the lens. I don't know if the actual pointer works.
Yeah, you can see that. You can see those really clearly, Aris.
You can see the little rings, and that is, these are the elements that help you focus both for distance and near, and also intermediate. And this is sort of the type of lens that we sometimes use for cataract surgery, but we can also use it for refractive lens exchange if you are not suitable for laser eye surgery. For example, why would you not be suitable for laser eye surgery? For example, you have very thin corneas that, it's not very common, but it can happen, and then laser eye surgery may not be the best option for you. And either of these two procedures may be an option for you. Anything to add to that, David? Or
yeah, no, I think that's. I think particularly with ICLs, I think the first ICL patient we treated here at the Nuffield, which was with that lens exactly in 2004, had a correction that was -16. The second patient we treated again back in 2004 was -20. So often we use ICLs with really high corrections. I think one of the big advantages we have with SMILE now is typically we would go up to about -10, -9, -10 with LASIK, and then we would look at ICL procedures. Again, with SMILE, we know that SMILE offers such excellent biomechanics. It's a fantastic procedure for high myopia. So again, you've got a number of options, and we will put all of the options to you, so you have a really good idea of what's available, and then recommend what we think will suit you best. Some people have really strong views. Sometimes we have patients who have done an awful lot of research, or we have a lot of people who refer to us for second opinions, or who come to us for therapeutic treatments. And often, I've seen patients this week who are really well researched, and provided the treatment is safe and is going to give you a good result, we're happy to look at that.
Yeah, and you said some people come along and said, I'm interested in Presbyon because they've looked it up. It's not available in many centres in the UK. It's probably 6-7 centres, something like that Presbyon. So they sort of come to us because they live sort of in the south coast, south central England. So they sort of come having looked it up. So another common question is, how much does it cost? How affordable is laser vision correction? How affordable is SMILE and Presbyon? And these are the quoted prices that you can find on the website. Everyone publishes their prices. It's not, but the reality is it's much more affordable than what you think. With the finance options, it can be affordable as £50 a month. The Nuffield Health collaborate with finance companies that will provide you with finance quotes to help you fund this. But if you're wearing contact lenses, for example, over, I don't know, probably less than 10 years, it'll cost you less to have laser surgery than to keep funding your contact lenses. And that's probably without changing your glasses in addition that you need as a backup with your contact lenses. So overall, absolutely, if you factor all these into the equation, it's not as expensive as people think. And the most common question, the most common response you get when people ask you how much is, oh, okay, is that it? Okay. Because so when you mention laser, lots of people think you're talking about many thousands of pounds. So it's not as expensive as most people imagine. And of course,
I look back to my time with contact lenses. Sorry, I was just going to say, I look back to my time with contact lenses, and you think, by the time you've bought, you know, that several pairs of glasses, prescription sunglasses, change them every 2 years, boxes of contact lenses, it's a high cost.
Yeah, exactly.
And just not convenient.
Yeah. So now it's over to you. I mean, you got the opportunity to ask any questions. We're going to check what questions we have, and then we can address those for you. So if we go and see what questions we have, do we have any questions?
So we've got a good question here. It says, are there any particular lifestyles that are ideal? I think often with smiler laser, we concentrate on you know, people who are kind of getting outdoors and doing active pursuits. But I think nowadays, really, it's as simple as things like going to the gym and just being active, getting outdoors and not having the hassle or going for a swim. But the other big group of patients who we're now finding are just people who are using screens. If you're using screens for long periods during the day, people are now returning slowly to offices, but particularly when you're at home using screens, often people are using screens even longer because they don't have that commute to the office and they don't have time in between meetings where they're going off and meeting other people or going for a walk. They're actually got back-to-back meetings. So a lot of patients are coming in telling me that, you know, they're working much harder in many ways than they did, and they're spending a lot more time in front of the screen. And if you're wearing varifocals and you're kind of moving your head around, or you're wearing contact lenses and they're drying out, we're getting a lot of people coming back. So I think the demand for that, we're certainly seeing an increase in that.
Again, I was walking with a colleague the other day, and we walked. She wears glasses, and we had our face mask on, as we do nowadays. And the moment we walked in, the glasses just steamed up, they fogged up. And that's sort of becoming another common reason now to consider laser vision correction, because if you're wearing glasses, then with the mask, with the face mask, they tend to steam up, especially when you change environment. It becomes quite a significant issue nowadays. So that's a new sort of indication for treatment.
Masks, absolutely, Aris. I think masks are driving necessary for our safety, but driving everyone crazy. If they're wearing glasses, they're horrendous. And we're in summer at the moment. Once it starts to rain and there's moisture in the air, I think you know it's not going to help. We've got another good question here. If I contact you tomorrow, how soon could I have screening? How soon after that could I have treatment? Screening we run pretty well every day. So I think if you want to come in and have a screening, we can arrange that for you more or less at your convenience during office hours. And then treatment, we're booking into lists now in July and August. But again, I think we're filling up pretty quickly. So I think we will always endeavour to try and get you in. But I think if you want to do that in terms of getting into a treatment list, I think have a look at trying to get a medical consultation in as soon as you can. Aris, over to you. I can see another few have flashed up.
Yeah. Another common question that we get is it safe? Okay. Is laser surgery safe? And as you heard David when he was explaining that the archive image, laser surgery is done on the outside of the eye. So what laser, you saw in the animations as well, is that it alters slightly the profile of your cornea. So it's actually done on the outside of the eye. So it's not an intraocular procedure, as we call it. It's not done on the inside of the eye. And what that means, it is very, very safe because it's not an invasive procedure for the eye. What do we fear with laser surgery? Well, what we fear is something called infection. So infection for the eye is really, really rare in relation to laser surgery. It's in the order of 1 in 5, 10,000, so it's uncommon, very uncommon. We've not had any cases of infection in relation to laser. Out of those 1 in 5 or 10,000, the majority of those are treated. So although it sounds like 1 in 5, 1 in 10,000, the risk of you having loss of vision in relation to laser surgery is negligible. It's very, very small. It's more likely that someone will have another accident rather than have an accident in relation to laser surgery. That's the uncommon.
Yeah, I think you mentioned earlier, Aris. Aris and I are both consultants at Southampton, a big university teaching hospital, and I guess in our day job, we look after an awful lot of people who have really severe corneal infections. The large majority will come from contact lenses or injuries or trauma. So we're used to managing patients with problems at the front of their eye, but thankfully, the vast majority of those come from sources that are not LASIK. I've got another question here, As I've just seen come up at the bottom. What can I do in terms of my recovery? So for that first couple of weeks, I think we showed a slide looking at return to activity, but for the first 2 weeks, what should and shouldn't you do?
I think even 2 weeks I mean, your vision will be improved more or less 6/6 or 20/20 by day 1, if not by day 1, by day 2. But we really want you to take care the first week, especially the first 3-4 days, and avoid getting water in the eye, because we mentioned infection and water carries potential risks. So we like you to avoid having a shower. We supply you with goggles, for example, that you can wear, or you can get swimming goggles, and that will keep your eyes dry if you're having a shower, if you're having a bath. So it's important to avoid contact with water. Generally, we want you not to do much the first few days, not because you're going to damage your eyes or something bad will happen, is so that you can focus on using the eye drops. The first week or 2 weeks, you use quite a lot of drops. The frequency goes down on a daily basis, but we want you to focus on using those eye drops the first few days especially, because again, they're going to help your eyes settle, and also they'll help prevent any infection. And again, lubricant drops, dry eye is often mentioned with laser surgery. It's very uncommon to develop significant dry eye with laser surgery. Again, when we see you in the clinic, we assess for any underlying dryness. And that is something we take quite seriously and take into account when recommending one treatment or the other. So part of the drops that we use are lubricant drops. So we like you to focus on using those lubricant drops. Just it allows the eye to settle quicker and your vision to stabilize. Because in the first week or 2, probably a bit longer, your vision will fluctuate a little bit. And that will be because of some dryness or tear film instability. And that's why the lubricant drops will help you with achieving that stability and permanently good vision.
We will provide those drops to you. So there's a question here. I've seen some London laser eye practices who are charging £6,000 plus. Will I get a better result, or is everything that you do included in the price? The answer is yes. We do include everything in the price. So we like to think that this is a centre of excellence. So, but we don't tier the pricing. So, in other words, we will see you beforehand. Aris or I will perform your treatment. We will follow you up, and we will provide you with all of your eye care drops and follow-up appointments, and all of that is part of your laser package. There's a great question here about what about the biggest difference what do your patients say is the biggest difference to their lives after treatment? I can say this for myself and from the patients, and it's freedom. I think it really is freedom. I think we hope that people are going to have good corrected vision before they have LASIK, but the big difference when you've had laser vision correction is you're waking up and you can just see, and even if it's, you know, for me that 10 minutes in the bathroom putting in contact lenses, and I think we're all feeling it with lockdown and isolation. I think that kind of liberation and freedom from having to use a visual aid or a visual prop to see clearly, and really just being able to go about our daily lives seeing well without the need for that, I think is a big difference.
Yeah, it's definitely that freedom. It's the waking up in the morning. That's by far the most common comment you get when they come and see us in clinic. They say, oh, I woke up in the morning and I didn't need to search for my glasses by the bed. So that's by far the most common reason.
We've got a question here about eye makeup, Aris. So when can you wear makeup? When can you wear eye makeup after you've had laser vision correction?
Yeah, I would probably avoid eye makeup probably for a couple of weeks after the procedure. And there's a variety of reasons for that. One is we don't want you doing anything close to your eye for the first week or two. We don't want you to injure the eye or scratch the eye. Lots of makeup, when we see patients in clinic, has actually gone into the eye. So when you place something on your lashes or around the eye, lots of those little particles actually go into your tear film, and we can see them floating about when you blink. So we don't want any of those little particles scratching your eye or causing more dryness to the surface. So those are the two reasons we'd like you to avoid using any eye makeup for at least a couple of weeks afterwards. Again, with SMILE, I'm more happy if you do it sooner, but with LASIK, I'd probably do a couple of weeks at least.
Yeah. Other face makeup you can wear after a few days, but with eye makeup, it's really avoiding either poking yourself in the eye, putting it on, or rubbing your eye hard, taking it off.
Yeah.
I've got, just scrolling down the last few questions. There's a question here. How long are you in the hospital for if you have laser vision correction? Aris?
Yeah, you've heard us talking about the actual duration of the procedure. You're probably looking at about half an hour of being into the laser room that is just behind David. You typically come in a good half an hour earlier before your actual treatment time. The nurses will admit you, make sure you don't have any allergies. We'll go over all that information again. And then you'll come up to the laser room, you'll have your treatment, then you have a cup of tea. So probably you're looking about 2 hours, and probably looking at a couple of hours you're into the hospital.
Yeah, you won't be rushed really. You'll be moving quite nicely and efficiently through the process, but we won't rush you. So it'll be nice. It'll be quite a nice experience.
Yeah. And another question, is it painful? We've covered this. Laser eye surgery is not painful. Lasers do not cause any pain. And to be honest, we don't use much anesthetic, not because we're stingy, but it's not an uncomfortable procedure, a very comfortable procedure. You're aware of what is happening, but you're not feeling any sharpness, you're not feeling any pain. So yeah, pain is not really an issue. People usually jump, or if you're really stressed, some people will look around or jump just because there's some background noise or will chat, but it's not because of pain or anything like that. It's very uncommon to experience pain during these procedures.
This is a really good question I've got here. It says, I'm really super cautious about anything to do with my eyes, so I may need a bit more reassurance than most. Is that okay? I'm going to say from both of us, definitely yes, it's okay. Again, that, you know, it's perfectly natural to be cautious about your eyes. So we fully appreciate that. And yes, as much time as you need is absolutely fine. And we'll often say again, if you want to come back and discuss treatment again after your medical consultation, you're very welcome to do that. We're also very happy to e-consult. So if you need any quick questions, we can do that. And so if you need to just, often people will walk out and that's the point at which you think of the 2 questions. And I've had all sorts of questions ranging from contact sports. I had a lady who asked me all about the risks and benefits of LASIK. And then just as she was going out, she asked if she could go skydiving the day after the procedure because she was a skydiver. So yes, if you've got any questions, it's our job to answer them and put you at your ease. And if you need more time, that's no problem. That's why we're here.
Again, this is a good question. Is unlike other high street providers, we're a private hospital, based in a private hospital, and there isn't that real pressure to move on to the next patient. So the laser lists tend to be quite a relaxed day. So there's definitely no pressure at all to get one patient in and then the next patient in. So you can actually take your time. And some people are more anxious than others and they take a little bit longer to settle down. And by being in this environment, we have that opportunity to take our time so that everyone feels comfortable and they get the treatment that they came for and they get a good result at the end of it. That's what it's all about. So I think...
Okay.
Next question.
Okay, you must have loads of success stories. I need that really stand out. I've got one immediately, which was a lady who I think I spoke about, who was minus 23, and we counselled her for LASIK. She ended up having an ICL procedure, and it was absolutely transformational in her life. I think she had gone for a huge amount, a long period of time, dependent on thick spectacles, and I think once you become really short-sighted, it's really functional. If you don't have your glasses or you lose a contact lens, you may not be able to cross a road safely. You've got to get through school somehow with everyone around you. So I think that was really, that really stood out to me as somebody whose life was kind of turned around. And you can see that often by the way people come in to see us in clinic the day after treatment or a week after treatment. Their posture changes and they're really different people. Aris?
Confidence with when they walk into the clinic or they give you the thumbs up as they walk in, you can see they're really happy. But there's a chap that we did corneal rings for, David, you probably remember a few months ago.
Yeah.
He actually got up from the table, the sort of the bed that you saw there, and so, wow, guys, I can see in HD now. Yeah, and that was literally within seconds. So that is a really nice chap, and we got a rapid improvement in his vision so instantaneously. That was really impressed. So as one of the laser, I mean, one of my best stories is a lady for cataract, well in her 70s with her only eye, and she walks into the waiting area and I call her in and she comes up and she gives me a hug in the waiting area because she can actually see now, whereas before she was struggling to see. So I think overall, that's not a success story, it's more of an emotion sort of patient-doctor story rather than a success story, yeah. And that's the reward of ophthalmology, of doing eye surgeries, that you can really, really improve the vision, but it's not just vision, it's the life of a patient. Yeah.
Yeah.
Really rewarding.
Absolutely. Brilliant. Aris, I think I've got here, what do I do next? What do I do next? I think we've got that on the very last slide. So next step is please give us a call. Call us on that number 0238181 000, or please be in contact 0001. Sorry, or please be in contact with us. Contact us through the web or come in through our email address help@laservision.eyecentre.co.uk, and we will look forward to seeing you for your complimentary screening or your medical consultation.
Yeah. Okay.
Okay. I think we've exhausted the questions, Aris. They were brilliant questions this evening. So thank you very much for asking those. And we will look forward to seeing you soon, we hope.
Yeah.
Okay.
Thank you for attending our webinar. Okay. And we'll see you soon, as David says. Yeah.
Okay.
Have a
Thank
good
you
evening.
for attending. Okay.
Bye-bye.
Bye-bye now.
Bye-bye.